survived well. He became leukemia free. His bone marrow became normal. And finally, after 1 year, doctor who had given me death sentence in Royal Muscle Hospital, he was so curious. He came all the way from London to my place in Meerut. And what he was more interested in the formula. And I smiled at him. I gave him the formula. But in Ayurveda, formula has no meaning. It is the processing which is important. Like my degree, my formula is BMS. You are all BMS. But we are all different. How we grasp, how we mutate, how we practice. So same thing, Ayurvedic processing is the key. Same food items can be different, but if the cooking head is different, the taste will be different. Same thing with Ayurvedic medicine. So when I cured that boy, when the British doctor came to India, Dr. Narayanan, who was Science and Technology Minister, he heard this story and he was so inquisitive. And he was the first politician of my life. And he tried to meet me. I was reluctant. But finally, two persons from Kerala, Dr. Mr. K. Gangadharan, who was a journalist that time, and his friend, they came all the way to Meerut from Delhi. They persuaded me, and finally, I could meet Narayanan sir. And Dr. Narayanan was so much, his understanding was so great that within the first meeting, he became great friend of mine. And he lived for 18 years after that. And not a single day he was not thinking about me. He supported this work by tool and nail, whatever, tooth and nail. And he was very much behind the scientific bent of mind of Ayurveda. And I feel that Ayurveda, which has been written 1,000 years or back, using parameters and protocols of those era, it is the high time that we convert Ayurvedic knowledge using today's technology so that the benefit of this special branch, especially Rash Shastra, will reach to the masses. I'm very glad that now lately, again, Ayurveda Shala pharmacy is again started making bhasmas. And because it was there in 18th century, there was an era when it has disappeared. But finally, Russia is making it back. So today's topic, I was told that I should talk about oncology. It is right that I have treated many cases of leukemia using Ras ortiz, and there was remarkable improvement, long-term survival. I have plenty of cases in Kerala, in Chittoor, in Mallapuram, in Palakkad, in Koilon, so Talcheri. All these places I have been to Kerala, and every city I can find my 20 years old, 15 years old, 18 years old patients who are still surviving. So when uh, Jignesh told me to talk on cancer, so I said cancer is a wide subject, but Ayurveda can do so many things for cancer, but until unless we have a consolidated data, we cannot claim that we can cure all type of cancer. Treating one case, single case report, short-term follow-up is the biggest weakness. So today, my topic will be on a disease which is the precursor of cancer. And coincidentally, southern state of India has the highest incident of that disease, which has nearly 40% conversion of cancer. So my topic today is on pancreatitis. Pancreatitis, which is inflammation, which is inflammation of pancreas, and this is very well known that pancreatitis may lead to pancreatic cancer, especially hereditary cancer and other cancer. So we are treating this disease very successfully. The formula was first evolved by my father in 1972. He took copper, mercury, sulfur, and mercury was processed for 9 months. Copper was Samana Shodhan, sulfur was Samana Shodhan, and after that it was amalgamated together by using Lafayette-Data and Clatoria ternacea in lemon juice. And after the grinding, it was dried up and put into a furnace. under the concept of Gandacharana, which I will show in my lectures. So today, when we talk about prevention of pancreatic cancer, we will show you that how thousands of cases who have been enrolled for treating pancreatic cancer, none of them has been progressed to pancreatic cancer. And that's why we can say that Ayurveda is a wonderful anti-inflammatory, and inflammatory lead to the cancer. And here, treating pancreatitis through a standard Ayurvedic treatment protocol might be a model for the prevention of pancreatic cancer. So what is pancreatitis? Many of you know that it is inflammation of the pancreas, and the word signifies, and it is the blockage of enzymes within the pancreas, and that results in the cell destruction of pancreatic tissue. It is two type: acute and chronic. And acute means sudden onset of symptom, but without any structural changes. And chronic may be the same, sudden onset of symptom or recurring symptom, but with moderate to severe changes in the morphology of the patient. There is no known cause of pancreatitis, but TGAR-O factors are very well accepted in the world, toxins. And in toxins, when we are in Kerala, people say Topioca. Topioca might be the cause of pancreatitis in Kerala or in southern state. Idiopathic, genetic, autoimmune, recurrent, and several acute pancreatitis obstruction. But in our experience, what we see when I was treating in Kerala, I didn't find much cases with tapioca. Similarly, I didn't find much cases with alcohol. So our cases were more idiopathic, where tapioca and alcohol were not visible, even the genetic factors were not visible. And I will tell you that how Indian pancreatitis is different than the other one. And but before that, I would like to tell you what are the symptoms of pancreatitis. It is the sudden onset of pain in the upper abdomen radiating to neck with nausea, vomiting, hysteria, and uncontrolled blood sugar and weight loss. These are the major symptoms in majority of the cases. But pancreatitis cannot be merely diagnosed by a normal physician. You need a gastroenterologist who is not only the master in diagnosing pancreatitis. He should be well aware with the other disorder of GIT, and there are certain tests which are required: EUS, CT scan, blood test, ERCP, and the non-invasive therapy is MRCP. And modern medicine manage pancreatitis by emergency hospitalization and with protein and fat restricted diet and lifelong enzymes as the disease not known why it is the cause. Similarly, they don't know what is the cure. So patient undergoes emergency hospitalization and lifelong enzymes with very strict dietary restrictions. The disease is irreversible, progressive, and fatal in nature. These are the data from America, where they say 40% turn into pancreatic cancer, 90% develop uncontrolled diabetes, and even in a country like America, 55% patients die within 20 years. But Indian scenario, this is different. While the world has 1 to 27 in 1 lakh, Indian, it is reported the southern state of India has nearly 114 to 200 cases out of 100,000. And but our findings, which is based on nearly 1,500 cases, we can say that we have more patients from northern India. If we use the Google Web, northern India outnumber the southern state, and I think it is quite obvious because there is only one study claiming that southern state of India has the highest incidence. There's no other survey has been conducted in that. Let's think
Sir,
about the cause.
sir,
Yes,
your slides are not changing, sir.
lights are not changing. Just a
Still
minute.
the introductory slide.
Just a minute. Is it coming now? Is it
Yes, sir.
there?
Yes, sir.
Okay, I
Thank you,
will.
sir. It's
I
fine.
will use. Thank you. You should have told me earlier. So these are the Tigaro factor, and this I have discussed cause of chronic pancreatitis, how to diagnose pancreatitis, which I have covered. This is about the prognosis and mortality in pancreatitis. As I said, that 40% turn into pancreatic cancer. So I was talking on that. So there is a case, there is a study done by a leading gastroenterologist of Maharashtra who says that in this scenario, it is not alcohol, which is more prominent. It is the protein malnutrition and mineral deficiency and attributes of chronic pancreatitis. And he has named it tropical chronic pancreatitis. So most of the patients who are diagnosed in India, they fall into this TCP, tropical chronic pancreatitis. And here, I will be showing you things which is not from the books. I will show you, share only that data which I got from my father, and afterward, that I've been doing myself. So this was an incidental discovery in mid-70s by my late father, who used to prepare his own medicine following the concept of Rashastra. And in that category, he took mercury. Mercury he took from Hingul. He extracted mercury from Hingul. Then he make amalgam with copper. 7 times he made amalgam, again evaporated. And 7 times it was this organic poison, and that is called Bumukshit Parat. It is nothing to do with Ashsanskar Parat, but the reference is mentioned in Rastarangni. So this mercury was subjected to copper, and copper was subjected to sulfur, and after that it went into Gandak Charana. And Gandak Charana is so important in the Shastra. They say whether mercury is Ashsanskarit or normal, until unless it undergoes Gandak Jarana, it will not have therapeutic value. So my father used this concept and he gave this name, medicine Amar. And this medicine uh, made a recovery to a dying cases of cancer pancreas in 1972. And after that, this practice was there between 1972 to 1997 as a retrospective study, where few cases were being cured, but there were certain hiccups. Sometimes my father was making the same medicine, he was not able to prepare it. But gradually, when I joined him after my graduation, I could develop a SOP, and now we are having a standard operating procedures in making these medicines and treating the patients. And this slide, which I'm going to show you, this is an eye opener. You can see 1111 cases. Today, when I'm talking to you, it is more than 1400 cases. But somehow I could not upgrade my slides as my scientist is on maternity leave, so she could not give it shape. So this data shows when we analyze our data on 100 cases, on 250 cases, 555 cases, or 1111 cases, we found UPs on top. So UP patient, my found central UP and eastern UP. We have the highest incidence from that. The second state is Maharashtra. And there was very funny comment. They say because you are from UP, you are getting patient from UP. Then I said, how come I'm getting from Maharashtra? So some sarcastic made a comment that your color of the skin is Maharashtrian. That's why you come from Maharashtra. But here we can see that whatever we are seeing, Uttar Pradesh, Maharashtra, Delhi, Karnataka, Gujarat, surprisingly, Uttarakhand, especially the area where we live in Kumaon belt, it is on the sixth area. And it is more prevalent into south in the rice developing place, whether it's a Chhattisgarh or Kumaon area or Haryana, the place which grow more rice, the disease is more prevalent in that. And you can see this Kerala state is there, Tamil Nadu. So if we see all together, nearly 25% come from southern state, and the rest come central and northern India. So this data we have shown in America, and we are the first one to make this demography status in the world. And the disease is basically onset is 24 years, but in our practice we are seeing fair number of patients who are under 11, 11 to 18 are there, but the highest incidence 19 to 45, and we can say as per Ayurveda, because this is Pitta dosh, because that is broadly if we categorize in the Pitta dosh. So Madhyam age, middle age is one of the major cause of the disease, or might be it is the most stressful age for the human being. This data is very much similar to the Western data, where male are more male are more suffering more than female. So same thing is with us. And all the patients who come to us, they were diagnostic not by pulse, not by Ashwin Pariksha. They were diagnosed by using ultrasound, CT scan, ERCP, MRCP, coupled with blood test. So these were the diagnostic tools. For all the patients who came to for treatment, they were diagnosed following Western model of diagnosis, but treatment was different. And one more thing, we find history of disease. Patient who came to us, nearly 92% patient has history of 10 years, and only 8% has more than 8 years. So that means in Indian scenario, which has no data, that 92% patient somehow die within 10 years of the diagnosis, because the disease is not curable by itself. Now I am going to show you something very unique. This is about the demography. It is saying family history. Genetic disposition is well known in pancreatitis, but only 5% cases are known about family history. Similarly, you can see in the last alcoholic and non-alcoholic, so nearly 50% patients are those who, so you can see the figure 1:2. Non-alcoholic are more than alcoholic, and non-veg and veg goes hand in hand. And similarly, non-tobacco user and tobacco user, non-tobacco user has high incidence of pancreatitis. So this is very confusing, and it doesn't give any conclusion that what conclusion can be drawn out of it. So anyway, we are showing what we have seen. We will discuss about Ayurvedic treatment protocol. It is a 1 year treatment, and the AMAR, which was given initially 6 mg per kg body weight after doing many scientific intervention. It is 3 to 4 mg per kg body weight divided into 3 doses. And there are supportive therapy, because many patients, somebody has gastritis, somebody has duodenitis, somebody has hepatitis, these are things. So this classical medicine, Prac 20 is a modified Pranava Mandur, Higuashtak Churna, Narikal Lavar, Rasonpati, Kamduda Ras, Lavan Bhaskar, Dhatri Law, Shivakshar Pachan Chud, and Sushekar Ras are given in combination with this Amar, which I will going to explain. And with that, there is a 3 meals, 3 snacks, like a diabetic patient, which is given to that, and complete physical and mental rest to the patient, because it helps in the recovery of the patient. And here, in nutshell, we show you that the disease which has a more than 92% death rate, we have only 2% death rate, whether they are treated 5 days or 7 days or 10 days. So we have 21 reported deaths who came to us, and there are 1% case are those who showed relapse or progression of the disease, and more than 50% patients who have completed the treatment protocol are complete remission, and 25% patients are on treatment, and there are nearly 25% patients who dropped out of the treatment. And there's a very interesting category is 21 patients who took the medicine but never started, because of fear, because of the poor credential of Ayurveda, because whether it will work or not, and there are 9 costs to follow up. So this is the clinical, observational clinical research. We are not doing any clinical trial, but whatever is coming to us, we document our practice. So our practice is under good clinical practice led by WHO. And based on that, what we generate our data, this is again an eye-opener. The patient who came to us 1 year before, they had a fair number of emergency attacks, say 1632 before 1 year of Ayurvedic treatment. And once they complete 1 year treatment, you can see that it has come to 110. So nearly 90% reduction in emergency attack after taking Ayurvedic medicine. And same thing, emergency hospitalization, which was 839 times prior to Ayurvedic treatment the previous year, which has come to 26, so only 5% emergency attack. So this was the strongest impact of Ayurvedic treatment, which was discussed in the 50th joint meet of American Pancreatic Association and Japan Pancreas Society, Hawaii, in October, November 2019. And Ayurveda talks one more thing, sustainable effect. The disease, the medicine should be able to treat the disease should not cause any side effect, should not cause any other disease, and it should be sustainable. The disease should not reverse back. So this slide shows sustainable effect. Many cases have completed more than 20 years, 15, 20 years, 10 to 15 years. So these all the patients who are under this, nearly 575 cases are under thing. And again, we say 2% patients are those who relapse or so 2% death rate is there, as we have shown in the picture. And there are a different type of pancreatitis. So in this slide, I can show you that these are many chronic calcific pancreatitis is highest, then chronic pancreatitis, recurring acute pancreatitis, and this is the beauty of modern medicine. Though we have also avarana dosh, we can cover it up, but we don't have that much objectivity. This is more subjectivity and with individual patient. So modern medicine has brought objectivity in diagnosis, and that is helping a lot. And based on that, we also know that which type of pancreatitis Ayurvedic treatment is doing better for those. So this is this, and this is an overview that our success rate is about 70% to 100%, 40%, 38%, 35%, depending on different type of pancreatitis and might be the severity. But such sort of analysis, especially of the diagnosis, helps a lot to categorize our work and take it further. And as I said, what is the backdrop of Amar? Amar is derived from Anand Shastra, which came to me through my father, and it is a 3 years old process, continuous process, which takes time. So we have a Rashala. Many of you might have seen it on the Facebook page or other YouTube, etc. Where we keep on showing our work, especially recently we made Javakar, we showed it. Whatever medicine we make, we try to show it to the share with the people who are not able to come from long distance. And the Rash Shastra was very much popular in India. It was involved in first century, and the 6th century, 8th century, it was very much popular during the golden era of India. But this Rash Shastra, as I said, was written using protocols. There is no direct reference of Rash Shastra in the treatment of pancreatitis, but it doesn't make any difference because Ayurvedic medicine are able to cure many inflammatory disease without giving any name to that. So here you can see mercury, which is extracted from hingot. There's a tamra, which is copper ions. It has been taken. Sulfur is there, amla sar sulfur, and lapha and Cladoria ternaceae, Aprajita Indian Valley, which is further titrated with lemon juice. So these are our basic raw material consumables. And then this mercury undergoes Uthapan, Urdhapatan Sanskar, Ingrodpatan to Tamrodpatan to Jodhpatan. So for that we have designed this shivling shape, Urdhapatan Yantra. Traditionally what we study, Dabru Yantra, this process is almost impossible using Urdhapatan Yantra. So that's why we have designed this shivling shape Urdhapatan Yantra. It is helping us a lot. So this mercury is evaporated 7 times from Tamrot and 7 times from Vish. That makes it Bubukshit Bharat or ready to work for that. And this slide is talking about Elam Gavamutre, Amal Ke Chakulat Ke, copper is being purified. And in this slide, we are showing the processing of sulfur. Sulfur is done. And once sulfur is done, this mercury, copper, and sulfur is ground together into the extract of Lophicinate and Cladoria ternaceae and lemon juice. And here you can see a microscope. We have standardized our grinding, that how much we should grind. And we have developed a protocol that as 40x, more than 90% should be less than 5 micron. And that time we take out from the grinding. So it is subjected to heating. And traditionally it was used on a special wood using clay pot. But later on, based on the data using computer-controlled heat sensors, we have designed computer-controlled heat furnaces where identical temperature was run, and these medicines are prepared using the standard temperature charts. And once the medicine undergoes this continuous heating for 24 hours, 60 hours, 72 hours, 120 hours, when it is cooled, it is taken out. And you can see in the bottom, it is a copper, sulfur, and mercury in a rock form. And some of the sulfur goes out during the processing.
Sarata hair and fridge irtu. Rendi soina.
I could hear certain voice, so I muted all. So this is process standardization and characterization, which was our major concern, that how to make this again and again. So following the WHO guideline, initially we started a program which was supported by Government of Uttarakhand in the beginning, and with the help of Indian Institute of Science, Bangalore, we are able to do process characterization and sterilization of the product. And here, three samples were prepared. You can see this red color or blue color is the mercury and copper. But more processing it goes, more peaks have come. And after 50th cycle, you will see there is no free copper and mercury in that. Similarly, with another batch, we find the identical things. And the third batch, batch 3, you will again see this copper and sulfur are going. And in this slide, this is the final formula of Amar, which has gone for patent with the competent authorities of that. So this is in a nutshell today's. I don't say it is a complete formula, but I can say there is no free metal in the finished product. So that means that Shastra technique are able to convert metals into mineral forms, and in that form, they are not only toxic, non-toxic, they also become beneficial or lifesaver to them. This formulation has been subjected to safety guidelines following OECD guidelines, and you can see here acute, subacute, and chronic toxicity, and then the Volcker N2 AEL. No observed adverse effects seen in any of the study, whether it's for 180 days or 28 days or single dose. So this is very heartening that Ayurvedic rasology, if processed well, they are non-toxic, and not only non-toxic, they are therapeutically effective also. Similarly, there was another study was carried on experimental mode, because pancreatitis can be produced in rats. So by using L-arginine, and many of you, if you go to gym, you might be knowing what is L-arginine. So by giving L-arginine, pancreatitis can be produced in animals. So there were two studies was carried where different doses were used of Amar in animals in different groups. And laterally, when the histopathology came, the first study it was found that a particular dose, it has pancreatitis protective properties. The dose is less, it doesn't work. If the dose is more, it doesn't work. So that's very interesting. What is the dose justification of Ayurvedic medicine? Anyway, the study was repeated again, and this time the dose variation was not much. So it was seen that 3 to 4 gram mg per kg body weight, and it shows pancreatitis protective properties. So this study was very positive to us. It boosted our morale, because many times when there was no pain in pancreatitis, it might be paralysis of a nerve which is showing the pain to the brain. But here, when we see pancreatitis protective properties, especially in histopathology, that clearly indicates that Ayurvedic medicine has a direct effect in reversing pancreatitis. So these are the result of the two experimental study, which was done in comparison to methylprednisolone, that Amar is effective at the dose of 3 to 4 mg per kg body weight, and more the dose or the less the dose, its effect also is affected. And that's why dose specification study should also be carried on Ayurvedic medicine. We are not stopping. We are continuously making efforts to take what is the science behind this. So we have designed a clinical trial. Very soon it will be taken care in some big institute of the country. When I was in Kerala, I wanted to do these things very much in RCC. Now many people are regretting, many people are quoting my model of research, but it was long back in 1999. And I'm glad that whatever the pathway I showed to Ayurveda, especially after Corona, people are going to talk about modern diagnosis and Ayurvedic treatment protocol. And I think it is within very much within the ambit of Dr. Uh, Urupa committee, where he said that modern diagnosis and Ayurvedic treatment protocol will be very useful for the society. We were not very lucky to be invited in India for our work in the beginning. So our first presentation, which came in 2018, it was in Philadelphia in America, where it was presented in third international conference on hepatobiliary and pancreatic disease. And similarly, the next one was in San Francisco. Uh, uh, and this was in Hawaii, finally, where out of 700 posters, we were the only Ayurvedic person and only Indian, non-allopathic Indian person who presented our work there. So this was in San Francisco and this was in Hawaii. 50th Joint Annual Meet of American Pancreatic Association and Japan Pancreas Society, Hawaii, USA 2019. And this was published in the abstract book of Pancreas, which is the famous journal of pancreatic disease. And this work has been reviewed by a high-level expert committee of CCRS, headed by Dr. C.M. H.M. Chandola, who was chairman of SAB, that time one of the leading gastroenterologists of India from AIMS, and CCRS people. They have recommended further research. And as the government is very much very good in recommending, in suggesting, and advising, so as they have done previously for my leukemia thing, they have again did the same thing that we have recommended, and no support has been given by government so far. Similarly, one university in the nearby, their scientists are sensitized. They want to do it, but resource crunch is the biggest thing because country doesn't have much teeth for scientific endeavors. But anyway, out of these things, we continue to do that. When we were 48 cases, we published our data in November 2014 for 48 cases. In 2015, we carried 100 cases. In 2016, we carried 250 cases. In 2018, we had 555 cases. And by 2021, we had 1111 cases. But now when I'm talking today, we are talking about nearly 1500 cases, and we will continue to generate data in the larger interest because ultimate aim is our patient, and these patients are available in testimonial form. If you have subscribed my YouTube channel, Vaidya Balendu Prakash, there is a program called Aap Beeti, where we telecast 2 success stories every month from Padav treatment, and these patients leave their experience, they share their number, everything, and they're available to the people who want to come for the treatment. So this is going on, and we are also publishing a news article, newsletter, Padav Times. At times, it carries our activities, and this is the media. This book on 1111 cases was released by Dr. Rajiv Kumar, who was the vice chairman of Niti Aayog. He's recently retired. So he was here. And then he took it to Atal Innovation Mission. And they're trying, our policymakers are trying their best to take this as a new innovation from India. And that's why our aim also, the Drash Shastra, which is very special branch of Ayurveda, if it is developed systematically, it can give many answers to those diseases which are incurable in the Western world. And these are the references of my lecture, which I have given you today. Whether the diagnosis or treatment, whatever is being done, is being projected here. And with these words, I must say thank you to all of you for listening me patiently. And if you have any question related to the topic, today's topic, or something else which I feel that I will be able to reply you, it will be a privilege honor to reply you. Thank you much. And with these words, once again, I thank the organizers, Dr. Roshni, Dr. Jignesh, for organizing this and inviting me to address this others gathering. Thank you very much.
Thank you, sir. Hello.
Yes, I can hear
I
you.
request other I request other delegates to please mute their mics. Thank you, sir. It was indeed a very valuable session. Now I suppose we can move on to our discussion and doubt clearance part. So without any delay, I request all the delegates to engage in this session and make this a lively one. You can use the hand raise option or even post your queries in the chat box.
मैंने स्कूटी कहाँ किया मैंने
So we got one question in the chat box. Dr. Sultana has asked, what are the preventive methods to avoid recurrence?
Dr. Sultana, the patient who come to us after 1 year of treatment, 90% patients remain disease free. And as you say, Ayurveda is Ahar Vyar Aushad. If they live a moderate lifestyle and moderate eating, they remain disease free without taking any medicine. Dr. Jitresh MK, your question is, can we manage acute pancreatitis? Very much. We get patient with 10,000 amylase, we get 8,000 lipase. And another thing, which is CA 19.9, when they say when there is a 300 CA 19.9, it is cancer. But in our experience, we have reversal up to 4,000 CA 19 point reversal to the normal state. So Ayurvedic treatment is very much effective in acute phase, in chronic phase, or in disease progressive phase. The question is, Dr. Shainaz, about management of severe pain in cancer. Every cancer is different, and management of pain in cancer patient is a big question mark, because I never treated symptomatically. So the patient who had pancreatic cancer, sometimes they improve a lot by using Amar. Sometimes a patient who's coming with gastric cancer and they have a pain. So I have seen by using especially prepared Sushekaras, and then pain disappears. Sometimes it is Dhatri Lord disappear. So I am not treating the pain, I am treating the cause. And once the cause is addressed, they get better. But there are different type of cancer, different type of pain, and management of pain is not my interest at all. If you need the PPT of my slide, I can send it to you, or it might be on your thing. And in case anybody has any other question or any comment, they can drop me in my email or my WhatsApp number. I'm always available. So should we call off the meeting?
There's any more, any other doubts, please hand raise. You can wait for just 1 more minute, sir.
Okay. I'm always available to you people.
Thank you so much, sir, uh, for the for extending the gratitude. We have with us Dr. Deepthi. I cordially invite Dr. Deepthi to extend the vote of gratitude on behalf of the organizers as well as the delegates.
Honorable dignitaries and dear participants, on the behalf of AMI at Malappuram, I feel immense pleasure to propose the oath of thanks. First and foremost, I thank our special guest, Padma Shri Dr. Balendu Prakash, who found time to grace our webinar by explaining us the common treatment principles in oncology. It was really a wonderful and informative session, Doctor. And we are very thankful for you thank you so much, sir. And I extend my thanks to Dr. Jitesh for his inaugural address and Dr. Roshni for her introductory sections. And I thank each and every members of AMI Malpuram and our participants. Thank you, everyone.
God bless you all. Thank you. Bye.